Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Aortic stenosis and the anesthetic considerations. So what we need to do is we need to maintain the normal sinus rhythm. So maintenance of the normal sinus rhythm. Next is to avoid the bradycardia or the tachycardia. You avoid bradycardia or the tachycardia. Or the tachycardia. Next is to avoid the hypertension. Avoid hypertension. Then we need to optimize the intravascular fluid volume to maintain the venous return. So optimize of the intravascular fluid, IV fluid volume. So you maintain the IV fluid volume to maintain the venous return. This is to maintain the venous return. And left ventricular filling. To learn and grow daily like this, please do subscribe.